SOS Golf Radio Network. On the line with us right now, Ken, is an orthopedic surgeon, by the way.
You don't say.
L. Ryan Smart. He is a board-certified, fellowship-trained orthopedic surgeon with SOS. He deals with shoulder, knee, hip, and elbow. All of them. I found out something about Dr. Smart. He was a former member at the Cornell University men's varsity hockey team and a talented player who was drafted by the New Jersey Devils during the NHL hockey draft in 1994.
Get
Thank
out
you.
of town.
Yes, sir. And he participated in the U.S. Olympic Festival for Hockey in 1995. Now, what else can he... Well, he certainly has a lot of information. Wait, there's more things here. His honors, first place Yale Orthopedic Surgery Anatomy. Let's get Dr. Smart on the line. Good morning, Dr. Smart.
Good morning, guys. Perry, you're making me feel good about myself here.
Yeah, you should. You know why, Doctor? Because I know you guys that play hockey, you hit the ball as far as any other athlete does because of that slap shot. Is that true, yes or no?
You know, it's funny. It's the slap shot helps you hit the ball far. I mean, it's a lot of the guys I play with from college that I can't say have a lot of touch around the green. Can sure get it off the tee. So there's no question. There's something with that hip and leg and the torque that helps you hit it.
Well, Dr. Smart, we like to talk about golf injuries, about prevention of injuries, about stretching, about strength training. And in your experience, because it happened to me, and there are so many people who are affected by this rotator cuff thing. It is amazing. I remember when it happened to me, I couldn't hit a ball 175 yards off the tee. And it was so frustrating, and I didn't know how to stop it. I never did go to see anybody, and I put up with it for a whole season. It was the worst thing to do. When should a golfer go see somebody? At what stage at this rotator cuff? You can still play. Sometimes it hurts, sometimes it doesn't, but you just can't get results. So when is that little trigger where you say to yourself, I better get to an orthopedic surgeon?
Well, I mean, that's a great question. I think a lot of times, and I'll see this in my practice myself, it's usually all about the pain. You know, I mean, as long as we can all mostly deal with little nagging stuff. But if the pain starts getting to you and you can't hit it anymore. And it's funny, the other thing that affects you is which shoulder is it and which side do you hit the ball from. I mean, usually most right-handed golfers are typically right-hand dominant. And if it's the right shoulder that's affected, so you can kind of get away with that, because your right shoulder, your right arm's a little bit lower. But if it's the left shoulder, and you're a right-handed golfer, that can really pose problems. And
it was left.
It depends on the pain. And then if you, like you said, if you just start, you can't hit it anymore. You lose your swing speed because it hurts, and that's usually when you got to pull the trigger if it doesn't go away after a little while to get in and get it checked out. Well,
I probably should have. And I played through the whole season because sometimes it hurt, sometimes it didn't. I just couldn't generate the club head speed, and I was lucky. I didn't do a thing in November, December, January, February, March, April, and I finally grabbed the club, and it was gone. It was gone, but it took that long. But usually in the rehab process, you determine whether there needs to be physical therapy or whether you need to operate. Well, what are the percentages? Is it like 50-50 with you? Do you operate on 50% of the people you see? And when does it get...
I think it's probably a lot less than that. I mean, most people we see, the first thing, if somebody comes in with a shoulder problem, they still have pretty good motion. Mm-hmm. A lot of times in its pain, if you can reduce the pain, rehab them, get them strong again, the vast majority do fine. If that doesn't work, sometimes we put a little cortisone in there to try to help them with the pain. And so if you do some rehab, you do cortisone, the still hurt, and then that's when you get to the infamous MRI and make sure they don't have a tear. And if they have a rotator cuff tear, and it's been a while, then you have to discuss, do we bite the bullet and fix it? Mm-hmm. Problem is, for most golfers, is when they start getting panicky, and I'm one myself, is this time of year. You put things off, and okay, I'm going to see how I do, but if you come in now and you have a shoulder problem that someone has to deal with and you have to have it fixed, you're going to lose probably the majority of your spring and summer. So it's really disappointing to feel because it takes so long to heal.
Yeah. But cortisone
but I think that most of them we can make better without surgery, and then there's a few that just linger and you got to bite the bullet and fix it.
Because cortisone helps a lot. It helped me a lot.
Yeah, cortisone can help a lot. I mean, it's certainly in orthopedics, it's never been shown to be a cure. It's never been shown to. But for some people, you get in a lot of inflammation and pain, you put some cortisone in there, and all cortisone is an anti-inflammatory. I tell people it's like taking that whole bottle of Advil or Aleve, putting it right where it counts, and a lot of times it can just break that pain so that the shoulder can start functioning better, and then boom, you're off to the races, and you're good, and you don't really have a problem again. Sometimes you get lucky like that.
Yeah, I had the hand problem there with trigger fingers.
Yeah.
And the cortisone just helped immensely.
Yeah, absolutely. And that's one of the things. Trigger fingers is probably one of the best scenarios for cortisone. I had a trigger finger myself. I'm a right-handed golfer. So my left little finger could not grip the club. And I had a cortisone shot. This is probably 7 or 8 years ago, maybe longer. One shot, done, it's never come back. That's trigger fingers that can be done. It can be an absolute cure. Whereas shoulders,
a little different.
Tougher. It doesn't work sometimes quite as well.
Well, Doc, I don't know. I didn't tell you this, but I spent 12 years in Ithaca up there. And yeah, I did. I was an
No kidding.
Yeah, I was an undergraduate. I got my master's there, and I also stayed on as the dean of men on the brand new campus. And that was in the 90s. Ithaca was really coming into its own on that South Hill there. But so you played. Did you play golf when you were at Cornell University?
No, I didn't. I just, I did I played. I was fortunate to start when I was young. I did the high school golf stuff. And then with hockey, it was just, it's just such a commitment. And then with the studies in school, I didn't. So that by then it was just, it was fun and recreational, and tried to hit it as far as I possibly could. Type of game,
of course. Well, where do you usually play your golf now, Doctor?
Well, now about 2 years ago, we ended up joining Onondaga Country Club because I was just desperate. I mean, through my medical school residency fellowship, you're just so busy. It was probably that's about a 10-year stretch to get through all that. I just didn't play much. I got 3 little kids, and I was just chomping at the bit finally in life to have a little bit of time. And so we live over on this side of town, so we joined up there, and it's been great. Last summer, I think, was probably the first summer I got to finally start playing golf again. And it was so nice to just go out and not feel like I was reinventing the wheel every time I went out. I have a little bit of comfort. And
are you better than Dr. Foddy?
What's that?
Are you better than Dr. Foddy?
John Foddy is a good golfer, but I think I could take some money off him.
Oh, okay. By the way, the Onondaga Golf and Country Club is hosting the New York State Senior Amateur Championship this year, so I will be competing there this summer, Doctor.
Oh, great!
And
that's great.
And he's good
we'll
too.
Get out and watch you in action.
He's good too. I'm telling you that.
Now, listen. Yeah. So, have you ever played? Have you ever had the time or to play Timberbanks over in Baldwinsville?
I haven't played. That's on my to-do list. I have some friends that live out in the Baldwinsville area. They play it all the time, and that's definitely on the to-do list.
Okay.
This summer for sure.
Okay, Doctor. I am going to call you, and you are going to be my guest at the Timberbanks Golf Club and Marina in Baldwinsville. You pick the day. It doesn't make any difference to me. You're the one that works 5 days a week, so if it happens to be on the weekend, you got to let me know. But I'm going to call you next week to set something up.
All right, Barry. Well, I appreciate that. That sounds like a great deal for me.
Yeah, now, this will not be the last time that we will speak because you're not only do you deal with the shoulder, you deal with the knee, the hip, and the elbow. We got that little tennis elbow thing flying around, too, that you can take some steps to eliminate some of the uncomfortable feeling that you get from those joints. But thank you very much for coming on the air, and I'd like to have you back in a couple of weeks.
Hey, I'm here anytime you need me, Barry. I really appreciate it. Thanks for having me on.
Okay, thank you, Doctor. Nice talking to you.
Take care.
Okay, bye-bye.